words of Mama Salma Kibeta, First Lady of Tanzania. I want to welcome you all participants. We have a broad range of constituencies of the Gavi Alliance present. We share one thing. We have that's our commitment to the Gavi mission, to make a lasting impact on the health and the lives of children through the amazing power of vaccines. You know that in this generation, when we are alive, we can do something about this. We do have the technology, we do have the skills, we do have the resources. Do we have the political willpower? Then it's possible. We have shown by the results of the last decade that it can be done, and we are in the process now of doing more. This is the framework of this partners meeting. It's a pleasure to welcome to the Gavi Alliance Partners Network also the representatives of the regional organizations. We have the Secretary General of the SADC, and of course his name is Thomas Salmo, and we have Dr. Richard Setsabera of the East African Community. Thank you, gentlemen, for exploring with us how regional organizations can leverage their unique assets to advance the cause of immunization. This Partners Forum will focus on 4 critical areas where we need to meet and to rise to the challenge. The theme is exactly that, rise. Easy to remember. R for results, I for innovation, S for sustainability, E for equity. That is our motto. I invite you over these 2 days to explore new frontiers in public-private partnerships, as well as those that strengthen the role of civil society organizations, especially with a view to enhance equitable access to vaccines, to share best practices, and to explore new strategies to deliver financial and programmatic sustainability. I invite you to explore innovations in science and technology aimed at closing critical gaps in the vaccine delivery. My hope is that these further 2 days of interactive discussions will help us to inform, share, inspire, and penetrate input for, not for Gavi as an alliance, but for the Gavi cause. The Global Vaccine Action Plan and the post-2015 MDG framework, it's all the sort of the back carpet of our discussions. But the Partners Forum is a Partners Forum. It's your forum. What you put into it of interest, of questions, of discussions on a bilateral basis in small groups around the breakfast table or in the fringes of the plenary sessions, it's going to decide what you take with you when you leave Dar es Salaam. So please engage. To a certain extent, we will also have the opportunity to engage in plenary sessions as this one, but there are many more opportunities to make use of them. We'll now see a few video clips giving us the context we are in. It's Tanzania, it's immunization. Roll the film.
We try our best that every child is vaccinated through a well-established network.
The aim is to cover 100% of the population.
Vaccination centers are free to all Tanzanians.
So the person who is wealthy or is poor.
The poor are the most vulnerable to all other diseases. In some areas, they can't afford to come to a field that vaccinated because it's a bit far.
There are special efforts to reach those who are far from the health facilities.
They have to, they tell those vaccination parents and then they go to the community to give them vaccination. Boys and girls in Tanzania are all rich. kuepusha na magonjwa mengine mbalimbali.
Mimi ndio muhimu wa chanjo kwa sababu watoto wangu wote ninawapeleka na chanjo.
It's progress to find other programs that can reach such coverage on a sustainable basis.
Although we have achieved a 92% coverage, we still have an 8% of the population to be covered.
We have pockets of communities where children got a lower rate of immunization.
There are communities living in small islands. This is a huge country.
We are close to 1 million square kilometers. And at the moment, the barrier to reach the remaining part of the population is not poverty or is not gender. It is actually terrain.
The lifestyle of this community is very difficult. That's also Karingo.
Baada ni viongo nyanya ndio bara ndio ngoro alafu katika zile na chanjo na program kutoka pale kutoka napo kwa siku moja mpaka siku ile kitu nyingine.
Basi
Umuhimu uko sana kwa sababu ni magonjwa yanayokuja kwa hiyo nyingine kutoka chanjo.
We need to travel even beyond, push the envelope, and going to the region.
we have a mobile clinic.
The health workers may come with difficulties. They will take them a long time to reach the community where they intend to vaccinate.
There are areas where there are no roads.
We reach the smaller islands by traveling by small boats.
Kuna ugumu kama mfano kipindi cha masika.
They are crossing rivers.
Gari ilikuwa
Areas and the wild animals are moving around.
Lions, during the night you can hear them roaming. It's dangerous in night.
But our health workers are really committed. They go for outreach and the night spend 5 days in the field.
wameelewa umuhimu wa chanjo na sisi pamoja na kutoa elimu ya afya wamefahamu sasa. Chanjo ni nzuri sana kwa watoto sababu juzi kuna homa za pele watu nchini kote wameangamika, lakini hao walikuwa wanapata chanjo. Kwa hiyo
and when we are doing these services, we do the integrated health services.
The challenges are enormous and many and significant.
But through their motivation, they ensure that children are vaccinated.
Like immunization was based on the premise that you only provide services to the areas that you can reach, we wouldn't be where we are today.
This is the context, this is the reality. But it's the reality for many, many Gavi countries. It's reaching every child, and it takes efforts. Small boats, vehicles, camels, donkeys, cars, bicycles, or walking by foot, climbing mountains. I want to give an extra tribute to those health workers that really bring these results about. It's now time to introduce my co-chair for this session. Her name is Flavia Buestro. Some of you know her well. She's the Assistant Director General Family and Women's and Children's Health at the World Health Organization in Geneva. She also serves as a Gavi board member. Flavia needs no introduction to most of you, but let me mention that her national health has been focused on diseases affecting the poor and the disadvantaged. She has been providing tremendous leadership in this area, also in the area of immunization agenda, including on our board. Flavia is a very, very energetic advocate for global health, for women's health, and for children's health. And she is an inspiring colleague to work with. Flavia, you take us further in the program.
Many thanks, Daphne, for that very kind introduction. Distinguished colleagues, ladies and gentlemen, good morning and a very warm welcome. On behalf of the World Health Organization, we are a proud partner in the Gavi Alliance. It's a special pleasure to be here at the forum of the Gavi Alliance. Let me say a few words to put this forum in context of the great development that are happening for women and children health around the world. 2012 was again a magnificent year that saw so many commitments and progress happening. At the World Health Assembly this year, we have an unprecedented discussion and commitment to the decade of vaccine. And many of the ministers that are here will remember the discussion was so vibrant and lively, but most importantly, there was a strong commitment to have reporting back every year at the regional committees and at the World Health Assembly of the progress the country will have made. So results. That was the tone of the discussion. But it was not the only aspect of progress in the women and children health arena. We also saw this year, led by the government of Ethiopia, India and the United States, a very important call for child survival to re-energize the call to actually end preventable child deaths in one generation. And that's co-led by our sister agency UNICEF, resulted in what we call the Promise Renew. And I know Gita will speak much more about this today. We also saw in July, with the initiatives of the UK government and the Bill and Melinda Gates Foundation, the Family Planning Summit, that was putting emphasis on one of the interventions that are critical for the survival of children, which is really access to contraception. And we also saw a launch of one report that spotted the light on what we call the preterm birth, which still in the world today account for 1 million deaths of these babies that are born preterm and for which we haven't managed yet to provide the care that is needed. And finally, in September, we saw this year at the General Assembly a great energy that was coming with the launch of the Commodity Commission for Life-Saving Commodities for Women and Children. Among all of these that I've described, vaccines are key for the acceleration of that progress that many of these initiatives have called for. And especially, we are excited about the fantastic introductions that many countries have managed during this year of 2 key vaccines, pneumococcal and rotavirus vaccines, that will dent that important part of child mortality that still lies ahead of us before meeting the target of the Millennium Development Goal. The Gavi Forum is a chance for all of us in the room to exchange, to gather information about initiatives by partners, but most importantly is to gather energy and strength from each other on the agenda that is further ahead. My task now is to introduce the energy giver and the energy master. The next speaker, which is Dr. Seth Berkley, is the CEO of the Gavi Alliance. He joined last year in August, so he's a little bit more than 1 year that he's at the helm of this alliance, of which WHO is a proud partner. And he has impressed tremendous energy and tremendous vision to the world of immunization and vaccine. He has stimulated the discussion to bring together the different streams and the different antigens that are part of this vibrant immunization community, beginning from the measles, the rubella, now the introduction of new vaccine, and also the HPV, which so many promises lie ahead for women health. Seth, the floor is yours to tell us about Gavi, past, present, and most important, the future.
So I can't tell you how delighted I am to be here. Jambo, everybody, karibu sana. I first came to Tanzania in 1988 when I lived in East Africa. I've been back many times since, but it's a very appropriate place to have the amazing people that have come forward for this meeting. We have ministers of health, we have the Honorable Secretary General of SADC, as well as the East African Union. We have distinguished first ladies, we have people in the immunization community, people from industry, NGOs. It's really an extraordinary gathering. So what I'm going to try to do, as you've heard from Flavia, is take you through a little history and then where it is we hope we're going as an alliance. Now, I think it's very appropriate that we're here today, and the symbol of what we're doing is a baobab tree. You can see it on the slide, you'll see it on the program and all around. And this is important because this tree has special significance in Africa. It's a tree that's revered. It's a tree where people gather underneath and talk about important issues. It's a tree where people go and talk to their ancestors. And so together we hope, as you've heard from Dagfin, we're going to try to use this as a time for us to come together and have important discussions. But I think we ought to start with our founders, because of course they had a vision. And I guess the question is, how are we doing on that vision? So let's listen to a short clip. This particular clip is from the World Economic Forum. I was in the audience. There's a lot of big talk at the World Economic Forum, but I think we are living up to their vision. Can we have the clip, please?
The ambition of this session is to share with you an initiative that aims at giving the children of the world their place in the sun. Gavi, the Global Alliance for Vaccines and Immunization, has the tall ambition of protecting every child against killer diseases, and thus lay the foundation for personal development, social development, and eventually renewed economic development for entire societies.
And if we didn't know it before, we now know that the single largest contributor to poverty and the single most vulnerable aspect is in fact health. So we've come together in this Gavi project because first of all it is the central development issue which is impacting the poor, and secondly because there is a ready answer, particularly in terms of children, to try and protect them.
And I always knew that vaccination was an incredible thing and that it was probably something we wanted to get involved in. I really decided this is one of the most important things going on. And it's certainly a priority, I think, that even comes before all the wonderful stuff, about the internet and how everybody ought to have access to that. More important is for people to have basic health rights. And that means all of these vaccines ought to be available worldwide.
The problem is that we don't have the means. We, as a country, was in war for 16 years. We had to rebuild all what was destroyed by war, particularly the facilities, health facilities, and educational facilities. So the vaccination programs are of great importance in our country.
The coming together of this alliance, public-private partnership, experienced UN agencies, pharmaceutical industry, developing world, the World Bank, is really an extraordinary opportunity to accelerate the activities that are presently going on to reach all children. And all children have a right to be immunized. All children have a right to survive.
The kind of cooperation, and I think this is what's different, Dr. Brimley, that Gavi represents will be essential for improving access to better health care and medicine for people throughout the world. Gavi can serve both as a model and a catalyst for public-private collaboration to improve the lives and save the lives of millions.
Certainly we need cooperation from lots of groups. We need the governments in the developed world to pitch in. In order to make it all happen, we need governments in the countries where the The vaccinations need to be delivered to Kitchen. We need the pharmaceutical industry. So we're just getting the critical mass. But I have to say, the creation of Gavi is kind of galvanized people to say, yes, we can do better.
So everybody, that was the challenge a little over a decade ago. So what, of course, is true is you are the critical mass. And as we look and as we talk, all of those groups that were critical to moving forward are in the audience today and here at the forum. We actually have at the forum more than 600 people from 55 countries. So, although we've changed and although we've grown, and we'll talk about that, our mission has not changed. Saving children's lives and protecting people's health by increasing access to immunization in poor countries. This is a valuable mission. This is what brings us together. This is the decade of vaccines, and at this meeting, we're going to have many discussions on the plan that came out of this effort and the exciting accountability framework that is going forward. But we are living in the decade of vaccines, and the work that we do is what makes it the decade of vaccines. So you've already heard, these are the main themes. These were most of the main themes in the Decade of Vaccine report. And these are what we're having the meeting organized around, and these are key to what we're trying to do. So let's start with the results part of this, because this is an organization, an alliance that values results. So what have we done since 2000? So we've immunized 370 million additional children. This is preventing or more than 5.5 future deaths. This is the DPT-3 vaccine, and you can see the spread of this from its origin until 2007 when it became pentavalent vaccine, and you can see it moving forward. The extraordinary thing is this was seen as a new vaccine, and as of 2014, every single Gavi country, all 73, will be using this vaccine. It is a routine vaccine, and that is what we're trying to do. Now, across this time period, immunization has gone up, and I will come back to this later in the talk. But I think what's important is if you look at the launch of Gavi, you can see that the high-income countries kind of stabilized in the mid-1990s, and it really was the launch of Gavi that lifted up the coverage, and you can see the coverage of the world also was lifted up, but it was because of the advances that were made in the low-income world. So this is the first injection of the pneumococcal vaccine given in Nicaragua just a few years ago. And you can see the march going forward of the pneumococcal vaccine. Again, one of the largest killers of children. And an extraordinary story in that this vaccine was made available about a year and a half after it was first made available in the West. This is the rotavirus vaccine. And you can see again the march of the rotavirus vaccine going across the Gavi world. Again, the largest cause of childhood diarrhea. Now, we couldn't do this without the support of our donors, and what you can see is the extraordinary increase, the quadrupling of resources that donors have made available to drive this incredible alliance. And what's also important is that we had an amazing event last June in our replenishment conference, where the donors raised $7.35 billion of money. 4.3 was new at that moment, 7.35 for this period. An extraordinary accomplishment in a very, very difficult time. Now, you know, it's what are we doing with this money? Take a look at the increase in volume of vaccines that are procured. So in 2011, 156 million doses of vaccine have been procured. And of course, this is something that is done in partnership with the supply division at UNICEF, who is the procurement agent for the alliance, and the manufacturers who have scaled up to produce this extraordinary quantity of vaccines. And look at the expansion of antigens. We started off with hepatitis B in 2001, and you can see the many diseases that we're now dealing with. And of course, we have two new ones you heard mentioned before. We're going to be rolling out measles and rubella and human papillomavirus for cervical cancer next year. Now, of course, you can't do this without having a health system and having health workers. This is absolutely critical to what's happening. It is, after all, the countries that are using these products. And we put a lot of effort into trying to strengthen health systems. I must say that over the time, we've adjusted our programs to try to meet your needs, because that's what it's about. We're about trying to support the countries, support what they're doing. And I must say, I know this is confusing, I know we haven't gotten it quite right, but we are committed to getting it right, and we will continue to work until we have health systems support that is absolutely in the bullseye of what you need to do this incredible work. So let's now talk about innovation. This is an extraordinary story. This week in Nigeria, the 100 million person will receive the meningitis vaccine. Now, for all those that haven't been in the meningitis belt, Men A was really a terrible disease. People would get meningitis in epidemic fashion. Whole villages would get infected. People would be sick. People would die. There would be terrible sequelae. A partnership came together, an innovative partnership coming together of manufacturers like the Serum Institute of India, the Gates Foundation, WHO, HAF. They were able to come together and produce a new vaccine that cost 50 cents a dose. And the challenge was getting it out here, and there was no shortage of demand. When people heard that there was a vaccine to stop this terrible disease, they lined up. This is an extraordinary accomplishment, and I must say and honor all of the ministers of health of these countries who have facilitated this moving forward. So, an example of the type of partnership that we've tried to do. Auto-disabled syringes. When Gavi first started, there was huge risk that with immunization, a small number of people, of course, it was always safe, it's a rare event, but a small number of people could have had transmitted hepatitis B, hepatitis C, HIV, and so a program began to have these auto-disableable syringes, which are now used in all of Gavi's country. We've been able to change the mindset and have people respect the issue of sterility, because of course in health, primo non nocere, first do no harm, is the motto of the healthcare worker. And we've been able to enable countries to be able to do that. Other innovations, you see on the upper right-hand corner here, a vaccine vial monitor, which has been on all Gavi vaccines for more than 7 years. This is an extraordinary technology that allows the healthcare worker in the field to tell whether the vaccine has been treated properly. And we're beginning to see changes like using SMS to reach patients, better stock management, and the auto-disabled syringe on the left there. But it isn't only in technology and vaccines that we've innovated. We've innovated in the financial area as well. The International Finance Facility for Immunization took the novel idea of taking donor commitments, long-term donor commitments, and using capital markets to be able to finance the work. And so far, Gavi has received $2.2 billion from IFM. But as important, in places as diverse as Japan and South Africa, people have come forward and bought these bonds. In Japan, they're called vaccine bonds. We were recently in Japan, and there's an insatiable appetite for these, because women often make the decisions to invest in the household, and they want to invest their money in high-quality bonds, but in bonds that are going to make a difference for the world. What an extraordinary partnership. We've also created an innovative partnership. It's difficult sometimes. We sit around a table with a completely different group of people, sometimes with very different interests. But we discuss the key issues, and we come together. And that is the strength of this, is bringing together all the diverse groups, the diverse points of views, towards our shared goals. And this has been a very, very important part of what we've been able to accomplish. Now, another key innovation is hard to target, it's hard to put in a slide. But when I started working in this field, I would have conversations with my pharmaceutical colleagues, and they would talk about high-income countries, the US, Europe, Japan, and they would talk about ROW, that stands for Rest of World. This was a fragmented market. It was countries that could or could not pay. They didn't know what was going to happen. What Gavi has done, and it's very, very important, is it's changed the mindset of industry, not just in the industrial manufacturers, but across the world. Because today, we're talking about bringing these countries together. And what's extraordinary is Gavi actually has more than half of the world's children as a birth cohort. So when we sit down with a company now and discuss a new vaccine, the question is not anymore, well, is that going to trickle down in a long time? The question is, how do we get those vaccines to those people? What is the mechanism? What is the partnership? How do we create a situation where we can create the volumes from the beginning of the manufacturing and not retrofit it later? This is an extraordinary intervention that will bring value, all the way into the future. Never again will a company have a life-saving vaccine and ask the question, well, is this ever going to get to the people who need it? Today, the question is only how, and what do we have to do that? Let's talk a little bit about sustainability. This is an important part of the program. You can see the growth in countries' co-financing. We believe at Gavi that some countries have adequate finance and some don't. And the ones that don't have adequate finance, we should help. But at the end, everybody should pay for the work that's going on. Everybody should have skin in the game, as we say. And that's a critical part of what it is we're trying to do. So last year, 100% of the Gavi countries supported their vaccines with hard currency, which of course is extremely difficult for many of the countries we're working in. This is important not only because it raises a lot of capital to support the program, but more importantly, it forces a discussion between the Ministry of Health and the Ministry of Financing and the Ministry of Planning and perhaps, and in best cases, the head of state. And this is what allows us over time to make this a sustainable program for all of those leaders to understand the value of vaccines, the power of vaccines, and why this is a good investment. With our work, with our pharmaceutical partners, we've been able to get extraordinary reductions in prices. These are the reductions in prices of the rotavirus vaccine. This is the reduction in the price of HPV, and you can see a little dashed line down this because the board said we wouldn't open a window unless we could do better on pricing, and our expectation is we will, although we're in a procurement round now. This is important towards long-term sustainability. And here is the reduction in pentavalent pricing. Now let me emphasize that everybody focuses on price, but to us the most important thing is a healthy vaccine market. We need to make sure that these products are safe, that these products are able to be available, that there aren't stockouts, that there's healthy competition. And of course, at the end, we want, but it's going to be very important in terms of keeping this healthy vaccine market. And my hope, of course, is over time that countries that just produce vaccines now will also be doing the innovation to bring us even new ideas and new types of vaccines, like we saw with the Meninge A program, which was so exciting. Lastly, let me talk about equity. This is a slide that many of you may have seen. I know it's been used in some of the previous Partners Forums. This is my 4th Partners Forum, so I did miss one. And what you can see here is the hepatitis B introduction, the 12 years it took to get out to the low-income countries after it was originally put out. And the date when it was originally began is etched in my mind because I was part of the original trial for hepatitis B, as I was a healthcare provider in Boston at the time when it first came. You can see here that what Gavi was able to do was shorten the time it took. On this slide are the number of countries being introduced. So you can see that we were able to shorten the time before 50% of the countries got this vaccine. And what's important about this is not only did we do that, but you can see that we were able to bring the vaccine to virtually 100% of the countries still below that in the wealthy world, above that in the wealthy world. So what we've been able to do is deliver even better than the places where these vaccines were initiated. Now, this is many years ago. I've already mentioned to you today what's been able to occur with pneumococcal vaccine and how quick that's occurred. That's what we're looking for. The ultimate goal would be simultaneous introduction in the North and South. That's what we want. And it's interesting. This is a slide taken from the Save the Children report on equity. It is looking at the difference between wealth, the lowest quintile to the highest quintile of wealth, and what you can see is one of the problems we have. Because although we're successful on a macro level globally, what we're not doing is reaching the fifth child, reaching the children who are in most need. And so I think this is a critical priority we'll talk about through the Partners Forum. I know this is a focus of many of our CSO partners. UNICEF, WHO are working hard on trying to do this, but this is where we really have to be measured, because we believe every child everywhere should have access to these vaccines. So these are some of the launches that have happened over this period of time, the last 6 months. And what you'll notice by looking through these is that these are some of the most difficult places to work in the world. And that is important because we do not shirk away from difficulty. And it's very important because these children are getting protected. And as I went through there, you saw that North Korea was in there. North Korea not only did a good job, but came up with US dollar capital to be able to pay its co-financing, which shows the dedication of the government to this important effort. But there are huge challenges. I've talked about the challenge of equity. 22 million children in the world are still not fully immunized. This is another challenge in front of us. How do we reach those? And you can see that these are in Gavi countries. India, the largest of these, and of course India, an extraordinary country, is just been able to eradicate polio and is manufacturing many of the vaccines we're using here in Gavi. So how do we get the Indian government focused on it? And I'm happy to report that, emboldened by what they were able to do in polio, India is on the move. Pentavalent is rolling out. They're moving forward with measles. They're talking about pneumo and rota. So I think it's going to be an exciting driving point going forward. But again, this is a challenge for all of us to discuss here at the Partners Forum. One of the reasons we have such a hard time is the state of infrastructure and the state of healthcare workers. Here in Tanzania, we heard that only 42% of the health workers that they need are in position. So these are challenges in the health system. And as we strengthen immunization, we strengthen the whole health system, and we strengthen the work across all of the interventions that are critical to try to save children. This is an example of the data system. The data system is absolutely critical. We have terrible problems with data. Example of cold chain, again, modernizing and work, and in this particular period going forward, UNICEF is going to make a special push working with WHO on the cold chain. Getting these vaccines out, it's heroic. You already heard Dagfin talk about camels and donkeys, and he's not kidding. People use whatever it takes. And of course, this is the dedicated health workers that are delivering. It's at the end of the day getting it into her hands at the lowest level so that she can vaccinate that is ultimately going to lead to this, which are healthy children who are in school, who are able to learn. So this is ultimately our goal, but we have a lot of difficulties in moving there. Now, we're known for the work we do around child mortality. And Flavia, of course, reminded us that it's important to think beyond immunization. But what's interesting is that Gavi hasn't only influenced MDG4, but also has been engaging with the other MDGs and having an effect on those. And that's an important point because immunization has an effect across not only the entire health system, but across many of the other factors that are important to healthy children. But what about going forward now? What about post-2015? So 2015 is an important year. It's the time when our current strategic plan ends. It's also the time when the MDGs end. So what is going to be next? Is it going to be Sustainable Development Goals? It's absolutely critical that health remains within whatever the next set of development goals are, but it's also critical that we finish the MDGs. So we have a dual task that's in front of us. And I'll talk later about what we're doing at this forum to try to continue that conversation. So one issue, which is not about the health goal, but is about our work, is about what we should do about immunization. This is a short history of immunization in a set of slides. And you can see in 1984, there was the beginning of the EPI program. At that time, coverage rate was around 5%. We don't have exact figures, but it was quite low in the countries that we're talking about. There were 6 antigens in that period, and this is what the world was trying to move forward. And you can see over time, I've already showed you this graph, that in fact we've seen a rise in DPT-3 coverage, which is the indicator that we use on immunization systems. There have been pushes, and there was a heroic push in 1984 when UNICEF, Task Force for Child Survival, the partners came together for universal childhood immunization. And by 1990, the world was able to get very close to 80% immunization. Another push came when the Millennium Development Goals happened, and there, again, there was a push as immunizations is one of the key indicators. Again, the indicators for these are how to get DTP3 up and measles vaccine. But what's happened since then? Well, there's a whole series of new vaccines, 5 new antigens I've already shown you. And so when we now move to the Gavi world, Gavi came in, we've already talked about the effect it's had on DTP3. You can see here the curves for Hep B and Haemophilus influenza type B. And you can see here as pentavalent vaccine moves in, this rising up. You can also see the new vaccines coming in, Pneumo and Rota. And of course, what we're trying to do, and we're going to discuss here, is how we take those up to that level. So today, when we think about what's the 21st century going to look like, we still need to obviously look at DTP3. That's an important indicator. But we're talking about a lot more happening now going forward. This is what WHO now recommends. It's 11 antigens, and they recommend that every child in the world receive these. So the question going forward is, should we be looking at individual antigens, or should we be looking at an indicator of the fully immunized child? Because at the end of the day, what we want is every child everywhere to be fully protected by the full contingent of vaccines that can make a difference in their lives. So this is just an idea that we'll be floating to discuss. It's not ready for prime time. We don't have details on the indicator. We haven't figured out how to measure it. But conceptually, this is really where we want to go. And it's interesting, because if we were to do this, today we're around a few percent of fully immunized children. By 2015, maybe we'll be at 10%. By 2030, only around 50% on current projections, and that is certainly not good enough. So the question is how do we change this trajectory? If we did this, we would reset, in essence, our aspirations, which I think is what we need to do. Now, of course, one issue is you see on this slide approximately. And a critical issue in the future is not just resetting the indicators, but can we measure it? Often today, I feel like as we're talking about immunization, it's kind of like, you know, we're shooting in the dark against the target because our numbers aren't very tight. We don't have tools that allow us to really understand what's happening. And what we really need is in the future to have indicators that are accurate, measurements and ways that we can really understand what's happening, not only in the immunization, but on the effects on disease. So this is a critical goal for the period going forward. We also need to use better technology. Today, most of our countries are still using paper-based systems, health cards, and yet the world has moved on. Here in Tanzania, I've been told that every tukul has one cell phone in it, and often 2 or more. So we know there's been this incredible spread of technology. How are we using it? There's been some extraordinary experiments in this area. Project Optimize and others have done that. But why is it that we're not looking, for example, on stock, so that we can have a map using GIS, and you can see here in a representative fashion, flashing red light, knowing that there's a stock problem in this clinic. And of course today, we have technology that allows to have measurements, RFID chips, that will actually tell where this is. You don't even have to scan it, although that certainly could be an intermediate. So this is not far-fetched. This is what's happening now in most of the world for most of the supply chain, and we just haven't used it yet in immunization. But it isn't only for the supply chain. What about for immunization? And again, this is already being tried in many places. Why is it that we don't know which child is missed because they passed their birthday and they haven't come back to the clinic? And why is it we can't use the GIS system to go in and send a health worker to that house to say what happened to this little child? Is that child healthy? Are there other problems? Did we miss it? That's what we ought to be doing in the future. Now, what about new vaccines? So, as you may know, SAGE recommended the inactivated polio vaccine as a vaccine for the world, is one of the suggested antigens for the world. The Gavi board will be discussing this as part of our vaccine investment strategy, but this is something that is coming. Cholera vaccine, again, something that will be discussed as part of our investment strategy. Malaria vaccines. We saw some very promising trial results. In older children, good moderate protection. In younger children, slightly less protection. And we're still waiting for data on how long the protection will be, and from WHO and the partners on what the recommendation is to use this. Dengue vaccine. We had a clinical trial that showed good results against 3 of the 4 strains. The 4th strain, we saw surprisingly not good results despite having good antibodies. Again, a trial is underway to understand that better. So these are vaccines that are coming along, but there will be others. And the challenge for us, again, is to understand how these play, and if they make a sense, we should make sure that everybody gets them. Of course, it would be remiss for me to not talk about HIV vaccines and TB vaccines. These are vaccines that are very difficult scientifically, perhaps the greatest scientific challenge in vaccinology, but extraordinary progress is being made on these. And so we don't know exactly when that last critical breakthrough is going to occur, but it will occur. I'm absolutely sure of it. And of course, we will welcome these into the armamentarium. What about cancer vaccines? We always talk about non-communicable disease. Cancer, of course, is seen as a non-communicable disease, but it's a little bit of a misnomer, because in fact there are cancer vaccines. The first cancer vaccine was hepatitis B. It is actually responsible for most of the future deaths prevented that Gavi has done in its first decade. It's an extraordinary story. It will prevent liver cancer around the world. We're now rolling out human papillomavirus. That, of course, prevents cervical cancer and head and neck cancer and other cancers. So this will, again, be an extraordinary vaccine to prevent cancer. What about others? There are other vaccines that are being made that will prevent cancers. Today it's estimated that about 1/3 of cancers in Africa are caused by known infectious agents. In the entire world, it's a little bit less, maybe 15 to 20%. But my prediction is, as we understand the biology better, we'll find out that infections have a huge effect on cancer around the world, and we will be able to prevent it by vaccination, as well as other chronic diseases, such as rheumatoid arthritis, inflammatory bowel disease, and other diseases that probably have an infectious trigger. Even diabetes, type 1 diabetes probably does. So at the end, we have all of these amazing vaccines, and you're going to have this, which is a very, very happy health worker, because she's going to be seeing healthy babies and not sick babies. So if we think about the field of immunization, and we're back to the baobab tree, what is it we need to do? We need to bring together all of the parts of immunization. And of course, critical to that is routine immunization. It's the thing that holds all of it together. These need to become part of routine immunization. And if we do that, and that's what we all have to discuss doing, and we have to actually make happen in our countries, we will have something extraordinary happen. We will see the flowering of the effort. And for all of you that don't know, baobab trees do flower. It's a rare event, and it is in this season that the baobab trees flower. So if we all come together and we work together, maybe we'll see that flowering. Got one more quick little film that's going to pull all this together for you.
Whoever you are. One highly effective way of helping everyone, rich or poor, to a better start comes in a little bottle. The impact of vaccination is greater than we ever thought.
I get sick less often, so I can go to school. My scores are higher in languages, maths, and in IQ tests.
I can finish my education and get a better start in life.
And while I'm at school, my parents, my family can do other things.
And since they don't have to spend money on my care, they can save it for better food, new clothes,
or a nicer home.
My vaccination also helps protect other people in my community.
If I don't get sick, then I can't pass it on. Because I've done better at school, I have more opportunities.
Earning money means I can help my family. As I work longer, I can also save for my future.
I can think about starting my own family and helping to build a community.
A healthier community is more stable. It's a place people want to live in rather than escape from.
People want to visit us and maybe even move here too.
Many others want to invest and to trade with us. That little bottle has consequences none of us could have guessed at.
Immunization has helped millions of children to a healthier start in life.
And better health is helping build a secure future
for people
everywhere.
So of course, what brings all this together is the amazing partnership that we have. And what's important is not only the core partners, but you saw an extraordinary new group of partners who are stepping up to this challenge, rising to the challenge with us. So we look forward to being with all of you here and to working together to ultimately do what this is about, which is to make sure every child everywhere has access to these vaccines and has a full and wonderful and fulfilled life. Thank you very much. I want to add one more point, which is over the next 2 days, you're going to have the opportunity to input into the post-2015 agenda actions for global health. Acting under the auspices of WHO and UNICEF, will be collecting suggestions for a report for the high-level panel. So they're not going to be in a specific place. They're going to be going around and interviewing people. So that'll be a way for you to get your input in. We also welcome all of you at the post-2015 dialogue, Grasa Michelle Nelson Mandela dialogue, which she's going to be hosting at 5 o'clock. And lastly, Gavi is a learning organization. And so we will be having an evaluation going on. We take this very seriously. So please give us your feedback, because we want to make sure that next Partners Forum will be even better than this Partners Forum, I'm sure will be. Thank you, guys.
Thank you very much. Like I said, you are really rising to your challenge as a CEO. We're proud of you. Thank you very much. Ladies and gentlemen, we had planned today to have Hassan Mashinda, Director General of the Tanzanian Commission for Science and Technology here. Alas, we were informed that he was not able to join us at the last minute. Mr. Mashinda was going to speak about the emergent sources of innovation in vaccine and related technologies, and in particular the role of low and middle income countries in vaccine research, development and production. I will not venture to substitute for this very recognized scientist, and I will though say a few words about the theme that he also highlighted, because it's a very important theme that will be revisited in several of the various sessions. The first word on innovation. Innovation is a part of Gavi's DNA, as you have clearly seen through the presentation by Seth this morning. And to meet the challenges of our task, we need to sustain and even accelerate innovation in all aspects of our work, including securing appropriate and affordable vaccine technologies, but also being constantly hunting for innovations in the way we work, from the board level out to the technical level. And I'm confident that we will be able to find new solutions in many of these areas. I really think that the way we operate, by being partners, not trying to dominate each other, where all the partners are coming together around the table, in my country, Norway, where I'm a member of parliament, we have an expression of this. When people in a village or a local community come together, trying to solve a local problem, that could be tidy up the football field, or it could be clearing wood, or just making it nice in the environment. We call it the dugnad. A dugnad is a place where everyone brings what they have, a tool, their time, maybe someone bakes a cake for the break, and then we're all contributing with what we have in order to serve our community. Well, that's exactly what Gavi is. We're all trying to contribute. All those who have anything to contribute in immunization come together. And those contributors are giants in their separate fields. Research, industry, civil society, the UN organizations, that, as we have heard and will hear later today, and the governments, the donors, the countries. And I think this is one of the secrets behind Gavi's results, is that we have been able to create this spirit of the dugnad, where no one dominates, but everyone contributes. That's critical to our innovative model of a private-public partnership. But I also think that we will see a new era in the field of research and development. I'm most excited by the prospects of better tapping expertise in the very countries where we deliver the vaccines to children who need them the most. Seth mentioned the exciting adventure of the meningitis vaccine, whose 100 millionth dose we celebrate today, as a great case in point. In the last 2 decades, developing world scientists have increasingly played a leadership role in the late-stage clinical trials. And in the next 2 decades, we can hope that their role will be increased from bench to board, upstream to tap the best scientists for early stages of research and development, and downstream to tap the best engineers for effective and affordable manufacturing in country. And with this exciting prospect in mind, I rejoice in thinking about maybe the very scientists we're talking about, who will bring the next generation of global vaccines breakthroughs to the world, are now the infants standing in line with their mothers, being immunized. maybe do this. I was so lucky to hold her in my arms during the field visit in Arusha beginning of this week. Maybe she will be one of those scientists working with the next generation of innovations and production of vaccines here in Africa. By vaccinating her, no matter how far and how poor her community is, we give the world a fighting chance against deadly diseases. So the baobab tree, which is our symbol, is called the Tree of Life. I think this alliance really is fitted for that symbol, a tree of life. For that reason too, we need to reach, as Seth touched upon, we need to reach every child. We need to reach that 20% that is not reached, that die unnecessary because they could have been protected if they had been reaching the 5th child. I cannot think of any person better to discuss this matter with us today than Geeta Rao Gupta. Geeta has a strong and passionate voice for the children in general, for all the children, and for reaching the 5th child in particular. Geeta Rao Gupta is the Deputy Executive Director of UNICEF. She came to UNICEF with a rich background from of her expertise in health, in the public and private sector, in the NGO world, and that has made her a highly respected leader in global health. Please welcome the Deputy Executive Director of UNICEF and the Vice Chair of Gavi, and I usually call her the Wise Chair of Gavi. So you can tell why we're successful. We have a wise chair in addition to a chair.
Good morning to all of you. It's a pleasure to join you today as we celebrate the progress that we have made together to date and to take stock of the challenges that remain. We're closer than ever to attaining our goal of reaching every child with life-saving vaccines. But by no means are we there yet. When viewed against the arc of human history, immunization has made remarkable progress, as you just heard Seth describe. Over 80% of the world's children now receive basic vaccines as measured by the coverage rate of the 3rd dose of the DTP3 vaccine, which translates into 4 out of every 5 children. This progress has been made possible through 200 years of hard work by countless scores of dedicated frontline health workers and policymakers and the inspired creativity of pioneers in science and industry. Yes, the road has been long and difficult, but profound milestones have been achieved along the way. The eradication of smallpox stands as just one example. The victory against smallpox involved far more than reproducing the virus and mass-producing the vaccine, though that was an essential first step. It involved more than transporting the vaccine to the areas where it was needed, though that too was an important achievement. It entailed more than convincing mothers and fathers that immunization was the right thing for their children, although their demand for safe, accessible, and accessible vaccines was and remains vital. All of these factors enabled the eradication of smallpox, but not without the dedicated efforts of an international coalition intent on eradicating the disease, combined with a relentless political commitment by governments to mobilize the resources and build the systems required to reach every last child with the life-saving vaccine. Admittedly, each of the factors that I just cited represents a Herculean challenge by itself. The good news, of course, is that these challenges are surmountable. The bad news is that we haven't been able to replicate the success of smallpox to the extent required. Despite our collective efforts, 63 countries have not received 90% coverage of the DTP3 vaccine. We are still missing an estimated 22 million children. That means that 1 in 5 weakest, born into families and communities that lie beyond the reach of our development efforts, isolated by conflict, natural disasters, or by the simple coincidence of physical geography. The fifth child faces many interrelated deprivations, which render her even more vulnerable to disease. For these and other reasons, the fifth child is far more likely to die before reaching her 5th birthday. The story of the fifth child is often undocumented and therefore untold. National averages that show strong immunization coverage often mask the pockets of disparity that lie within. Growing up in India, I witnessed how easily the poorest children can just fade into the background of society. A society in which the quality of access to basic medicines, health services, and education is determined by one's gender, caste, economic class, and geographical location. When discrimination and bias are woven deep into the fabric of society, reaching the fifth child requires much more than hard work and perseverance. It requires a conscious decision by society as a whole to denounce the notion that some people, through no act of their own, but by virtue of where they are born or the physical characteristics they receive at birth, are less entitled to be treated with dignity and to have access to the most basic necessities. It also requires a determined and deliberate effort to reach the hardest to reach children and communities with routine immunization. Doing so is a moral imperative. Every single child has the right to survive and to thrive. And yet, this fundamental right is denied to the 2.5 million children who die each year for a want of a vaccine. The time has come to shine a light on the inequities that deny the fifth child access to life-saving technologies. The social, economic, and geographical gaps that separate the fifth child from all others are unjust and frankly inexcusable. For too long, development experts have asserted that it's too expensive to focus on the hardest to reach children. But research by UNICEF shows that this simply isn't true. In 2010, UNICEF responded to evidence of widening disparities between rich and poor children by questioning the conventional wisdom that it is too costly to reach the hardest to reach children and communities. A modeling exercise involving some 180,000 data points from 15 countries showed that a concerted effort to reach the poorest and the most marginalized is not just right in principle, it is right in practice. The modeling exercise revealed that each $1 million invested in equity-focused approaches could prevent up to 60% more child deaths than existing program strategies for child health and survival. The argument for cost effectiveness is particularly pertinent to the field of immunization. Investing in the immunization of every child delivers huge dividends in society, as Seth just outlined for you. Society as a whole, in terms of deaths averted and reduced health costs. The benefits of reaching the most disadvantaged children with vaccines span generations. Healthier children perform better in schools, earn higher incomes in adulthood, and raise healthier children as parents. The experience of Tanzania is a testament to the feasibility and impact of a dedicated focus on the hardest to reach children. In 2009, 83% of the country's unvaccinated children lived in 53 districts. 83% lived in 53 districts. As part of the Reaching Every Child initiative, each district reviewed the data to identify the 10 health centers with the highest numbers of unimmunized children. Each health facility was then asked to draw a map indicating the exact location of the hardest to reach children and to explain the reasons for the lack of access. The health centers then developed and costed plans for vaccinating those unreached children. With the support of district authorities and committed teams of community health workers, the number of districts with coverage above 80% increased from 64 in 2009 to 99 in 2011. The country is now expanding this approach to another 19 districts. Tanzania's success needs to be replicated and scaled up if we are to succeed in vaccinating every child everywhere. We face a unique and exciting opportunity to do just this. We have the political commitment, as reflected in the endorsements for the Global Immunization Vision and Strategy in 2005, and more recently in the Global Vaccine Action Plan endorsed by the World Health Assembly in 2012, which aims to achieve 90% coverage in all countries and 80% coverage in all districts. And we have the international coalition, as evidenced by all of you who are in the room today, brought together by this innovative public-private partnership called Gavi, a partnership that brings together national governments, multilateral agencies, donors, industry, committed individuals, and civil society organizations. The Gavi Alliance has changed the way we wage war against preventable disease. The Alliance has proven that with the introduction of new technologies, we can make a generational leap. By daring to be imaginative, innovative, and bold, we have raised significant capital and ensured the delivery of vaccines to those who need them most. We have helped create markets so companies can develop more affordable products. As a result of these efforts, we have helped to immunize 370 million children, preventing more than 5 million deaths in the process. UNICEF, as a partner in the Alliance, supports the Gavi mandate by procuring affordable vaccines on behalf of national governments and by working with those governments on the ground to strengthen the supply and the demand for immunization. Our commitment to immunize every last child is part of a broader effort to accelerate declines in preventable child deaths. In June this year, the governments of Ethiopia, Nigeria, and the United States, in collaboration with UNICEF, convened the Call to Action, which brought together over 700 representatives from government, civil society, and the private sector to reinvigorate efforts to accelerate declines in preventable child deaths. Their response was overwhelming. 157 governments, including Tanzania, signed a pledge under the banner of A Promise Renewed, recommitting to maternal, newborn, and child survival. Several countries are already leading national efforts to translate their commitment into concrete results by scaling up action on 3 fronts: sharpening evidence-based country plans and setting measurable benchmarks, strengthening accountability for maternal, newborn, and child survival, and third, mobilizing broad-based social support for the principle that no child should die of preventable causes. In addition, 185 civil society organizations, 220 faith-based organizations, and nearly 2,000 individuals have pledged to support government-led efforts to scale up progress on maternal, newborn, and child survival. The momentum building around the goal of ending preventable child deaths demonstrates that we are poised to achieve another big success in child survival. The evidence is on our side. An analysis presented at the Call to Action demonstrated that it is in fact feasible to greatly narrow that grossest of inequities, the gulf in child survival rates that persist between the poorest and the richest communities in the poorest and the richest nations. The analysis showed that all countries, rich and poor, can accelerate progress towards the MDGs, and by 2035, every country can achieve a national rate of child mortality of 20 or fewer deaths per 1,000 live births. But only if you immunize the 5th child. To achieve this goal, it is incumbent on each of us as members of the broad Gavi Alliance to make every effort to seek out the 5th child wherever she may be, and to identify and address the factors that hinder coverage in immunization. That means systematically mapping and targeting unreached children. It means scaling up high-impact strategies for the prevention and treatment of childhood diseases. It means empowering mothers and families to make healthy decisions on behalf of their children. It means building robust supply chains for affordable vaccines, taking advantage of new communications technologies that are now available. And it means integrating the delivery of vaccines with other commodities that prevent and treat deadly childhood illnesses in line with the recommendations of the UN Commission for Life-Saving Commodities for Women and Children. By holding ourselves accountable for progress against these 5 key actions, we can and indeed must move the needle on the global coverage of routine immunization from 80% to 100%. Why not? In so doing, we will achieve a series of historic milestones: the eradication of polio, the elimination of maternal and neonatal tetanus, and dramatic reductions in deaths caused by pneumonia, diarrhea, and a whole lot of other infectious diseases. Vaccines make this possible, but only if we do this together. Together, we can give the 5th child the same opportunities that are available to every other child. That is the promise we have to keep. That is the commitment that must echo through all of our conversations, both today and tomorrow. Thank you very, very much.
Why not? That's a good question. There is no good reason not to. Now, dear audience, now it's your turn. I invited you to a partners forum. So take part as partners. The floor is now open for any questions or comments from the audience. The only thing I ask you is that you come to one of the microphones that you see. It's one here, one there. And is there a third one? I can't see, but at least there are 2 microphones. You can choose the one closest to you. And you identify yourself and you speak briefly. And if you have a question directed to one of the speakers, please indicate that. Yes, gentleman down there is first.
Simon Wright from Save the Children. Really welcome the focus on equity. It's got to be something which all Gavi partners are really focused on, getting the routine immunisation to all children. It's really a question for Gita about, I think the point you made very clearly about national average targets, which is what we focus on so much, but they actually do harm. They actually encourage countries to focus on the quick wins, the easiest to reach, and we've seen, and UNICEF's reports have shown, rising rates of ill health or other indicators in the poorest quintile, even if national averages are going up. The question really is whether UNICEF thinks about this as we look at what the post-MDGs are going to be like. How can we avoid this happening again if we carry on talking about national averages? Should we just get rid of those completely as targets and instead have targets for the bottom 2 quintiles? I'm really interested in what you're starting to think about that.
Gita, do you want to comment right away?
Thanks for the question. It's a very important one and a very timely one, because we're all in the thick of these discussions on the post-2015 agenda. I don't think we can move away from national averages, but I think we need to set a national average target that cannot be achieved unless you reach the 5th child. So I think there is a way, statistically, to figure out that if you want to get to the child in the most deprived community, what should the average be in order to get there? That's one way to do it. The other way to do it is to set indicators. So you could set a target, that's a national one, but then to set indicators that specifically focus on communities that are the poorest. Or it's also important though to remember that inequity is not just by income. So we will have to be careful in how we pick the indicators in order to measure where we want to get to.
I just had one point, which is, what is it we want to measure? We really want 3 indicators, I think, or 3 measurements. One is children who have never been reached by immunization, and we have to try to bring that to 0. Children who have been reached but haven't completed, and then the challenge is, we want to know where they are and make sure they get all their antigens. And then the third is children that are fully immunized. And if we could focus, in essence, on those 3, it would cover all of these issues.
Thanks, Ludwig. Gentleman down there.
Thank you. I'm Dr. Somebody. I'm the program manager in Surveillance in Bangladesh. I just some suggestion regarding the poly irrigation. In the year 1988, following 41 World Health Assembly, the global poly irrigation launched, and the target eradication of polymyelitis on the face of the world by the year 2000. But not possible. Then the target revised 2005, then 2008, then 2012. Now, as per the global decade action of plan, it is the year for certification from the face of the world by polio in the year 2020. There are so many countries of the world. If we decide to eradicate a disease from the face of the world, the strategy should be same. But there are some countries that are using the IPV vaccine, some countries use bivalent OPV vaccine, some countries use trivalent OPV vaccine, some countries use monovalent OPV vaccine, some countries use the sequential station of the IPV vaccine or OPV vaccine. So I just would like to say the strategy should be same as per WHO recommendation in the year 1999, sequential use of the IPV vaccine and the OPV vaccine for eradication from the face of the world. So production of the IPV vaccine should be, and it should be affordable for using this vaccine for all countries of the world, irrespective of developing and developed or low income. Thank you.
Thank you very much. That's a highly pertinent question. I would like to ask Flavia, maybe on behalf of WHO, who declared a global alert on polio. But first, Seth will give a comment to that question.
Thank you, and it is extremely complex. I think, we've gone so far with the oral polio vaccine. Of course, we have vaccine-derived polio strains that are circulating, and this new move is one that is trying to move to try to increase the immunogenicity, to make sure that in children who don't get the multiple doses that they will have adequate coverage. And also, obviously, we're getting so close to the end. There's polio now in the smallest number of districts, smallest numbers, and what we're really trying to do then is at the end to make sure that there isn't vaccine-derived polio that is circulating in those communities. But I think this is good news. Last to say that we will be discussing this at Gavi in terms of trying to work on it, and there already has been a movement on affordability. Manufacturers are stepping up to the plate. There's not only the existing vaccines, which they're trying to drive the price down now to make it affordable, but there's also new innovations that are coming forward that I think will be exciting, and we've even heard about the possibility of a hexavalent vaccine coming down the line. So I think lots of innovations in those areas that will be useful.
And as Seth has mentioned, our scientific advisory group of experts on immunization has discussed these questions that you pose at length. Some of the colleagues that are here can testify the passion that was in the room at that point. And it was seen as important, as Seth explained, number one, that we are able to stop the vaccine-induced polio cases that we still see. And we see this over time, the introduction of IPV as one mechanism to do so, but also to firmly include the polio vaccination within the routine immunization that every child, a fully immunized child, that we are projecting to the future. So it is firmly as what we call the polio endgame that was increasingly really brought forward, also in terms of looking at what's the legacy
that the polio eradication effort will make, and this will remain within the legacy. Thanks.
Let me add on behalf of the board of Gavi that it's exciting to see that the polio eradication plan now focuses more and more on routine immunization as the road ahead. And as it does, we will, from the Gavi board side, explore the ways that we can help in bringing about not only polio eradication, but a solid base for routine immunization against polio and all the other diseases, as we have been heard about today. Okay, we have room for a couple more questions. The lady down there. Yeah. Please.
Angelina here from Global Health Strategies.
You need to go closer to the mic.
Angelina here from Global Health Strategies, and this is really a question for Seth and Geeta. So it was very exciting to hear that Tanzania is introducing new vaccines, and while I agree with Seth that India is on a roll, India still has been slow in introducing vaccines and does have the challenges of high infant mortality rate and the largest number of unimmunized cohorts. Is there some discussion within the Gavi board on how it can support India to accelerate that role?
I think Seth is eager to respond to that.
So of course, at the end of the day, we can be partners, we can help, but we can't do. And that's why I'm excited that India is emboldened now and is moving this forward. We are working with the Indian government to try to do some health system strengthening in the low coverage states, and that I think is going to be an important addition. But the other thing that's happening is Indian manufacturers are stepping up to the plate to try to produce these other vaccines, which will also have a catalytic effect. And our hope, of course, is that India will, in this interim period, before they have their own produced vaccines, do some demonstration projects with the new vaccines, which will then allow them to get some of their own experience, some of their own data that will make them comfortable in when the vaccines roll out to take them to national scale. Gavi, do you want to add?
I just wanted to say that the other ingredient, which is political commitment, seems to be much more visible now than it ever was before. You know, the Indian government co-hosted the call to action in June, and has announced that they're going to do an Indian call to action in mid-February. So, at which they're going to announce exactly how they're going to sharpen their health plans and the focus that they have on the children who are most likely to reach. So we're hoping, but I have to say that ultimately, in a country like India, it is those social inequities that stand in the way. So there's work to be done by a whole range of partners on a whole range of social issues, and vaccination is one piece, but if that work is done, the vaccination piece will get easier.
Thanks. We have a lady down there. Please, you go first. Please.
Oh, okay.
Floor.
Okay, this is Rana Haji with the Centers for Disease Control and Prevention in the US. And it's wonderful to see the immense impact that Gavi has had over the last 12 years or so on the introduction of new vaccines. Of course, it goes without saying that in order to accelerate the introduction of these vaccines, a lot of work went into generating the evidence to help countries make these decisions, whether it's data on disease burden, data on the impact of these vaccines on the various aspects that really help with the decision-making process. And I would really like to thank Gavi for doing that, having been part of the HIP vaccine introduction myself. But I would also like to hear how Gavi sees its role in the future, continuing to support some of these activities, which I guess would fall under each one of these elements, whether it's results, innovation, providing the data to show where are the differences in equity or inequity, as well as what do we need to do better sustainability. Thank you.
That's a big question. It's another seminar, but I know my CEO is able to give a brief answer to big questions.
So first of all, I have to apologize because I had one or two data slides that actually didn't come up in the presentation to try to show the value of that. And we just showed at the board an extraordinary slide, which you kind of got a gasp around the board table, which was in Kenya at a Kilifi. We had a graph that showed the previous pneumococcal disease, invasive disease, looking like this prior to vaccination, the introduction last year with it looking like this, and this year with it looking like this. So extraordinary data on outcome, and that is really what we need. And I'm happy to say that although the board has been quite clear that our job is not to do research, there's a lot of research organizations out there, that impact measurements and understanding this extraordinary experiment that we're doing, which is to take, across the entire continent of Africa, but across the world, these powerful vaccines and move them out is something we have to do. And so actually, the policy and committee of Gavi actually said we have to invest more in this, and so we will be investing more in it, but it's not going to be on research, it's going to be on trying to understand this impact, of course, working with other partners.
Thank you, Seth. Gentleman down there, next, please.
Thank you. My name is Dauda Mane. I'm the Director of Human Development Department in charge of health and education for Islamic Development Bank in Saudi Arabia. I would like to really thank Gavi for extending an invitation to the IDB and to comment on Gavi and the countries for the remarkable achievement. Personally, I witnessed this progress. I was privileged to attend one of the first Gavi Task Force on Financing meeting in July 2000 in Washington with Annie Pastor. And I really witnessed the launching of Gavi and all the progress. So I'd like to comment on that. I'm here to say two things. One is that 29 of the 56 IDB member countries are benefiting from Gavi support. And the Islamic Development Bank concentration on the health sector is mainly fighting against disease, communicable and non-communicable, and number two, health system strengthening, which are all the area of focus of Gavi. So there is no reason that we cannot work together, and I would like to mention that in 3 weeks ago, and Faisal visit us in Jeddah, and I'm here to follow up on this discussion to see how the Islamic Development Bank can support work with Gavi to scale up this very cost-effective intervention in the health sector. And we are very open to partnership. We have signed MOU with all UN specialized agencies, and we have MOU with all the multilateral development bank. With the foundation, you may be aware that we are working closely with the Bill and Melinda Gates Foundation. We are supporting the effort of the government of Pakistan eradicating polio. We are putting $227 million, and we are considering doing the same for Nigeria and Afghanistan. Thank you.
Thank you very much, sir. That is something we really appreciate, and be sure we will work with you as a partner in the future, as we've already started to do. And we welcome very, very much the clear message you sent now. Looking forward to the exciting follow-up of that. I believe we can have 2 more speakers. So, yes, sir, and then the lady behind in the white shirt is number 2, and then Flavia will have to wrap up. There will be other sessions where there will be a possibility to speak, but we have a schedule to follow. Sorry about that. Sir?
Merci, moi je vais parler français. Alors, je n'ai pas de questions, mais je suis médecin, je suis précédemment directeur de district, je suis directeur régional. Aujourd'hui, je suis parlementaire et on parle de vaccination. Donc je suis heureux d'être là. Dans l'exposé, je voudrais remercier. L'accent a été mis sur les enfants, le 5e enfant qui vit très loin, qui est difficile à atteindre, mais seulement je voudrais souhaiter. Je n'ai pas de questions, je l'ai dit, je n'ai pas de questions, mais il faut mettre l'accent sur le maintien des acquis de Gavi. Ça veut dire que dans les grandes agglomérations, il y a encore des quartiers difficiles à atteindre aussi. Et nos acquis doivent être préservés. Tout à l'heure, ils ont dit que le DTC3 était à plus de 90%.
Excuse me, sir. Could you just pause for a while, because I don't think the translation system is working. Sorry about it. Do we have it fixed first? Or... Okay. I think we continue. You have a statement to make, not necessarily a question. So why don't you make your statement?
Donc je reprends, c'est ça?
Enfin.
Je disais que je suis directeur du district avant, directeur régional, je viens de la Côte d'Ivoire, je suis parlementaire. Aujourd'hui on parle de vaccination, je suis heureux d'être là. Dans l'exposé, l'accent a été mis sur le 5e enfant difficile à atteindre. C'est bien vrai qu'aujourd'hui encore, il y a des enfants qu'on ne peut pas atteindre facilement. Mais seulement, il faut qu'on mette l'accent sur le maintien de nos acquis, de préserver nos acquis. Ce que nous avons déjà eu comme taux de protection dans les grandes agglomérations, dans les villages et tout, avant de parler d'améliorer à 100%. Il faut maintenir d'abord nos acquis. C'est vraiment important pour moi. Et pour maintenir les acquis, il faut préserver la gestion des vaccins, il faut préserver la logistique, il faut préserver tout ce qui entre dans l'efficacité des vaccins avant de parler à 100% d'atteindre les enfants dans les contrées. Je suis bien d'accord avec cela. Mais pour les atteindre, il y a les routes. Il y a les routes qui sont difficiles en campagne. On ne peut pas atteindre les enfants. Il y a aussi le problème de refus des vaccins. Il faut mettre l'accent sur ça, la sensibilisation, la mobilisation. Comment est-ce que quand Gavi va se retirer, par exemple, dans la fourniture des vaccins, comment rechercher les ressources, en Afrique surtout, pour préserver la disponibilité des vaccins, pour préserver nos acquis. Et c'est cette contribution-là que je voudrais apporter. C'est vraiment important. Au niveau du Parlement, nous avons des projets de loi à faire sur la vaccination en Côte d'Ivoire pour que des moyens soient mobilisés, pour que quand Gavi va se retirer, il faut que nous-mêmes on se prenne en charge et qu'on soit autosuffisants pour la survie des enfants, parce que c'est vrai, les enfants doivent être en vie, les enfants doivent être en bonne santé. Je voudrais sincèrement dire merci.
Monsieur, j'aimerais d'abord vous remercier pour cette intervention, c'est magnifique. Ça, c'est vraiment l'alliance in action. Parce qu'on a besoin des gens comme vous, qui sont médecins, qui sont parlementaires, qui comprennent très bien toutes les étapes qui sont nécessaires pour rejoindre cette 5e enfant. Donc, vraiment, merci beaucoup pour sa contribution et je suis sûre que dans cette discussion, ça va être repris beaucoup. Merci.
Merci.
I'm asked to give a little the content of the contribution, which was really making the case for the whole chain that is necessary for reaching the 5th child, and putting the accent on what we have already achieved so that we can protect that, but also looking forward to the future, to the sustainability of those investments, and asking what is our thinking and the vision for making sure that the countries and governments, especially in Africa, will have the resources for making that work sustainable.
Thanks to my co-chair for explaining, and my apologies for not having the system standing. We'll fix that for the next session. Please, you're the next.
My name is Carolyn Hart with JSI. My question is also for Seth. First of all, thank you to all speakers this morning. My question is, actually it's a vote of appreciation for your comment that maybe Gavi has not yet gotten it right on health system strengthening. And on the theory that we learn perhaps as much or more from our difficulties as from our successes, I wonder if you would say a few words about what hasn't gone quite right and what the plans are for doing it differently, or what the process is for determining how to do it differently. Thank you.
Well, first of all, let me emphasize that Gavi is a learning organization, and we embrace when things don't go well. Now, only we embrace them because then we have to work on trying to fix them. So
we are doing an analysis of what's happened, and in essence, you know, we believe fully that our interventions need to lead sustainability, that they need to be integrated into national systems, but we also want to make sure that they have an effect on immunization, because if we can show success, it will have an effect across the entire system. So one is making sure there's a real linkage. Another is that we are able to measure that, and we're looking at, are there intermediate indicators that will allow us to measure, because of course it's a much longer time that we're going to see the effects of these. We're asking questions, are we providing the right technical assistance to countries so that they can use these funds in the best way, that they're able to map out issues of their supply chain, so the interventions, again, are in the right place, so they have the systems in place, the data, other issues. So to help me with this, we've recently set up a technical advisory group led by Anders Nordstrom, who of course has enormous experience in health systems, and brought together a series of fabulous experts who are there really to give me advice on how we think about moving this forward. But most importantly, and at this forum, we will be having conversations with the countries and understand for their perspective what is it we could do better, how to move forward. And we are looking at the different modalities and trying to also speed up our interventions, because they haven't been as fast as they could be or as simple or as well explained. So those are just a few issues, but at the forum you'll have a lot of chance to hear about the different changes and interventions that are occurring.
Colleagues, is it on? Yeah. So, colleagues, we have begun with Seth presenting us the RISE, results, innovation, sustainability, and equity. This is our slogan for the forum these next 2 days. I think the session today has really helped us understand what have been the past 10 years that Gavi has, and also begin to see the vision for the next 10 years. So on the results, I think there is a lot we have heard that to be proud for us as partners in the Gavi Alliance of what has been achieved in increased coverage of several antigens, including, as Seth has explained, pentavalent vaccine that has now become part of routine immunization for so many countries. So a lot to be proud. But there is also a lot to be done for the new antigen that we have available, especially pneumo rota, that will contribute significantly to the reduction of under 5 mortality rates. And for the human papilloma virus vaccine, that for which we have increasing tremendous demand from countries for that vaccine that will prevent death in women from scourges like cervical cancer that increasingly are becoming leading causes of death among women, as we conquer some other scourges like maternal mortality deaths. And in fact, in some regions of the world, like Latin America, cancer among women is contributing to a higher proportion of death than maternal deaths. So this is part of the future of Gavi. For the results, if we look at innovation, Seth explained the range of innovation that this extraordinary partnership has brought to the world. But there is a lot to look forward for the decade. Innovation in service delivery. We have understood how do we manage, how do countries manage to deliver those vaccines together with the other essential interventions, together with the strengthening of that health system that is part of the foundation of public health. There will be, no doubt, other innovation in the financing. This is the alliance that has been at the forefront of innovation in financing and innovation in measurement. You will also hear more in some of the sessions this day and this afternoon. Measurement for accountability. This is a word that resonates in many, many halls. Accountability for the results and for the resources that are available through the Gavi Alliance, but through many of the partnership and the alliances and the contribution the governments allow for health. The other word that we heard is sustainability. And here, from the floor, the critical importance that is for the future. What is a sustainable impact that Gavi is planning to make? What is the mechanism through which Gavi will empower and support countries to graduate, as we say in the language, and to be really able to have the resources and the means to produce and empower health workers to give those vaccines with their own means. This is a challenge, and I hope that during the discussion, you that are the power brain of the Alliance will help us find the right solution. Finally, for equity. We have heard in the discussion and from our colleagues from UNICEF that this alliance has contributed a lot in the last 10 years, but is looking to make a significant contribution for equity in the next decade. And we have heard that in fact it's not just the right thing and the moral and ethical things, but it's also is doable and will pay dividends for the society. In summary, I think we have heard that the Gavi Alliance and you as vibrant partners in this alliance are poised for the next decade to ensure that every child, and I will add, every woman, everywhere, will benefit from the new technologies that are available to allow them to be healthy, thriving, productive individuals living in our society worldwide with dignity. Please give your ideas, your contribution, your thoughts to this vibrant alliance to make sure this happens. Thank you very much.
You just sent a tweet. Is that your first tweet? In my life? With an attachment